Hello, good afternoon.
Good afternoon, sir.
Good afternoon, sir.
I hope everybody is fine.
We are doing
By
well,
the Lord's grace, please, and you.
Yeah, I'm also fine. Sewa here, the rep. Sewa, are you here?
Yes, please, I'm here.
I was thinking you should have reached out. Even though we know very well that we are supposed to come, but at least if we also put in some small check, I think it may
Yes.
also okay. Anyway,
Yes, please, I will do that next time.
here. I think we began our journey last week, right? We look at the general course overview, and we are going to be guided by those major themes or the thematic areas that were mentioned as part of the course overview. And there was also a bit of introduction to nursing informatics. So those of you who are missing in action, the most important thing is the most important segment of our journey is what you missed last week, because that is the anchor of the whole discourses that is going to guide our lectures. And I've been saying that is the foundational moment you shouldn't have missed. But anyway, so those of you who didn't come, you are welcome. And I also inquired, and then I got to know that you are more than the number on board now, close to 600. But I'm still seeing 213 students who are on board. I'm going to pay keen interest in your attendance. You don't think that it is just normal for you to be skipping lectures. Then you think you have done mid-semester exams, you are getting 25 over 30, you are getting whatever score, and you think that should stand or that should hold for you. So please, attendance is also very, very important. And I was very emphatic when I espouse some of these things. So please, those who are not here, tell them to join. Right? Anyway, I think as you are ushered into this particular semester, as far as informatics is concerned, though we did not go deep into what we are supposed to be doing, because it was just the opening session of our conversation, so it was just on a lighter note. But just of information regarding the introduction, I want to see how maybe some of you will just give us some reminders about the few things we said about the introduction. Please, is that clear to you? Is that clear to you?
Yes, please. Sir.
Okay. So who is going to set the ball rolling? At least if I get not more than, not less than 3 students, I think that will be very fine. So what did you hear last time about the introduction? Or even if you don't want to speak to the introduction, you can tell us something about the course overview. What did you hear? Okay, now let me go to my friend Agobia.
Oh, good afternoon, sir.
Good afternoon.
Thank you. Please, if I can remember, the course overview, what I heard was about patients' information, how we keep them in the hospital, about their data, the diagnosis, and then history. So we got to know about the earlier one that we were using books, and then now is paperless. So we got to a point and we're comparing the paperless and then the books. And we got to know that the paperless is good, for which the books, maybe with disaster or something, the information might be missing. the book can also get missing, or relatives can use the book to sometimes neglect their patients and all that. But with the paperless system now, information can be there forever, which is very much important. That is what I can remember. Thank you very much.
Gladys, thank you too for the feedback. If it is food, I would say sumptuous meal, right? That is a very good feedback. We just
Thank
have to
you.
compare and then contrast the paper-based system with what? The electronic health records or the paperless system. And we got to know that one of the characteristics of the paper-based system has to do with what? A lot of what? Challenges or fragmented what issues compared to the electronic health record system, where the thing, even though we may encounter some few challenges, but not as in the case of what the paper-based system. So I think that's a very good point. Can I also take it from someone else, a different perspective altogether? Can we pick it from someone else? Who else? Because you see, examination, that is why maybe, I don't know, your questions are not difficult though, but the way we are having the conversation this way, in the same manner that you should expect, your questions. So please, okay, let me go to my friend Joshua.
Thank you, sir.
Good.
So please, sir, I also learned from the last meeting that when we are talking about nursing informatics, it's more or less computer science. So as my sister was saying, in this nursing informatics, we are more or less using computer system in taking patient information. And we made mention of the LIMS, and right now it has been taken to GIMS. So it means that as we are moving on in life, new technology and the new findings are discovered. In health field, the way we keep patients' information is also advancing. And then one important of this system that I learned was where one of our brothers raised a concern about how doctors used to write medication when it comes to the prescription of medication for patients. They write it in a way that was leading to administration of wrong doses, but currently, because they are going to use the computer system, that's where they will type it. It is very clear, and then the one who is going to administer it is going to administer the right medication with the right dose, and then the patient will not, in that aspect, will not have any negative effect, and it is facilitating when it comes to the health of the patient. It is helping the patient's health, and then it has reduced high mortality rate in that aspect. Thank you, sir.
Joshua, I think that's a very good feedback. Your broad view of the things we look at, last week confirm your readiness to take this course, by storm. So I think that's a very good one. But maybe I will not say that is omission. An aspect of informatics has to do with what? Computer science, right? Where we are supposed to have how to be able to apply the basic tools in IT to deepen our understanding of what decision making. That is a major, a point here. But I also take you back to this one. We are looking at the foundational knowledge that we bring to bear, relying on these digital tools to arrive at what decision making. And that is what? An aspect of what? Informatics. So if the foundational knowledge is what missing, then the conclusion will be that we are relying solely on what? Computer science, which is not the case. We are also looking at what? Information science or information management. How we will also be able to rely on these modern technologies to better manage our information systems. That is also the major pillars of what? Our conversation. So it is like they are in multiples, or maybe somebody will say, I wouldn't say, if I say multimodal, then I'll be taking you into other forms like artificial intelligence, among others. But we are looking at foundational knowledge in nursing. We are looking at information science or information management, and then computer science. These are the bedrock on which our conversations are going to hinge around. Is that okay?
Say yes. Thank you very much.
I think I would say we have had enough. But if somebody think that you also want to give us a different thing altogether, you're also welcome to do that. Now let's move on to the course description. We have already looked at it, so I'm not going to go back. The course objectives have already been. So by the end of this session, or by the close of today, I'll have to share your slides because the semester is very, very short. Now the introduction to nursing informatics. Just as you are seeing here, nursing informatics is a powerful tool that showcases how nursing positively impacts healthcare outcomes. So the key word here is what? It's a powerful tool. So we are looking at all the enablers or the facilitators that ensure that we are able to make what? Better decisions. The ultimate goal is to arrive at what? Conclusions or decision making that inures to the benefit of what? The care provider and then the patient. We compare the paper-based system to what? The modern system, and then we notice quite a lot of what? Lapses when it comes to the paper-based system, and therefore the advanced system should be able to lessen the negative impact that under normal circumstances would have been occasioned by the paper-based system. So that is the conversation we are having. The purpose is to support nurses, patients, healthcare teams, and stakeholders in making decisions across various rules and settings. So fundamentally, it is not meant to be seen as a replacement, but rather to augment or support decision making. So that is why some people have raised concerns about AI. AI should not be seen as a defining moment or the ultimate, right? In the same vein that we are also looking at informatics, with a view that it is meant to complement the clinicians or the providers effort and not to be seen as complete replacement. Then we build our conversation around the major pillars of our conversation, which is going to be about nursing, and that is the foundational knowledge. And then we also look at computer science. These are the tools or the enablers that ensure that we are able to arrive at a very informed decision. Then nurses are ever faced with voluminous amount of information. And without relying on this modern technology, it will be difficult for us to be able to manage the weightier information that come in and out of the facility. And that is why we are going to look at information science or information management. How do you ensure proper management of your information system? And that is the essence of this conversation too. Now, we credited everything to the definition proposed by American Nurses Association, where they are saying informatics should be viewed as integration of nursing science, computer science, and information science to manage and communicate data, information, knowledge, and wisdom in nursing practice. So the major pillars of nursing communication has to do with data, information, and knowledge. Without data conclusions, and these are embodiment of the definition by the ANA. Then the American Medical Informatics Association also can just some slight changes, but I'll call you back, right? I mean, anything. Sorry for the interruption, right? I was okay. Anyway, so I was talking about data, information, and knowledge. So knowledge is very crucial, very critical point of arriving at decision making. So if you don't have, the right skill set, there will not be any need for you to arrive at decision. And then again, in as much as you have all the skill set, you have all the needed skills to transfer those skills to manage your patient better. If it is not also accompanied by wisdom, it can also lead to something we will have to suffer to deal with. So it is also very important that in as much as you have data, information, and the knowledge, you should also apply your wisdom in making your decision. Then the American Nurses Association, American Medical Informatics Association, they were also of the view that these technologies that are dominated, various spheres of what educational system, it should just lead to ensuring the improvement of what the plight of our patient. It should not cause any harm. It shouldn't cause any injury, but it should affect families, communities, or global view of what improving healthcare outcomes. That is their position about informatics, right? So these are instances of how we can achieve a better way of what communicating nursing information among what care providers and our patient at large. Now, before we can go deep into the conversation very well, I've spoken highly about the standard definition that is going to guide our conversation throughout, has to do with the American Nurses Informatics Association, right? Or there's the American Nurses Association, the definition coined by them. So an aspect has to do with what? Information science. So we have been able to compare and then contrast what the paper-based with what? The modern system. But let's further deepen our understanding of what goes into information science or information management and how we can optimize acquisition of what these modern tools or technology to improve upon the way and manner information is supposed to be managed. So as part of this, I will solicit your views about how you embark on your decision making. How you utilize these tools to make what decision. So I'll come for some perspective on that. Now, information science focuses on the effective collection, storage, retrieval, and use of what? Information and then knowledge. So we are looking at data collection. That is what? The information the patient provides to the care providers to better what? Aid in their decision making. Then when we have also gotten the information, how best to store the information, when to retrieve those information, and when we are supposed to what? Use them to manage our patient. It also integrates an aspect of our computer science, cognitive science, social science, communication, library science to manage and utilize information through various technologies and services. So information science on its own is a discipline altogether. Even Callistos. I don't know whether maybe somebody can also request for, a co-host so that whoever will come and then disturb us. If the person can also...
Please, we are here. I was about to meet him.
Sir, we've done justice to him. No problem.
Okay, that's fine. Okay, so like I was just saying, the information science is also a broad one. So when you talk about information science, library science is also part of what? Information science. And there are different aspects of what? Information science. All of them deepen our understanding of what? Information management, right? So whether you are looking at our cognitive dimensions of what decision making, you are also looking computer science in effect has direct what attachment or correlation with what information science because it was originally part of what computer science. But looking at the broader nature of what computer science, that made information system be considered as what a discipline or distinct area on its own. So if you go to those in computer science, they also do information systems, right? So that is it. Then initially a subset of what computer science, it emerged to optimize technology management within organization. So those information systems or information systems that are applied within the business, environment, also look at how they can also rely on modern technology to manage all, businesses, especially when it comes to decision making. So the healthcare sector has also adapted that concept of what improving decision making, relying on these modern technologies to also affect what healthcare delivery, right? So we adapted these concepts from the business field or environment to affect what decision making within the purview of what healthcare delivery. Information science has evolved into a significant field of management, gaining some attention in research and expanding its scope to exploit human-computer interactions, and then the dynamics between people, information systems, and an organization. So there's that kind of what interplay or interactions of what people, information systems, and an organization in their quest to use these modern technologies, right? It examined the study and applications of information systems, focusing on optimizing technology to enhance information flow within organizations. So before we move on to this, I would just want us to lay a very clear foundation of what we want to do. So I will take you back to information science. As part of this one, I'm going to solicit your views on what we term as the key umbrella terms in nursing informatics, which is tied to information sciences. This is going to open the conversation about the happenings at your facilities. So those key umbrella terms in nursing informatics, we can have what? The capture of information. Then we can also look at the storage of information. Then we also look at retrieval of information. Then we look at the sharing or exchange of information. And then again, the final one will be presentation of what? Information. So as part of your everyday usage of computerization in care delivery, as we are laying a firm foundation for this, let me get your views on how best or the best practices in terms of capturing patient information. We can also equate this one to data collection, right? So how do we capture patient information? We can, walk us through the happening from OPD through to the point where the patient is supposed to leave the scene of what decision making. Please, are you following the conversation?
Please, yes.
Yes,
Okay,
sir.
good. I wouldn't want us to. I wouldn't want to be running. So I have to pause and then so that I become more, interactive. So let me get your views on how do we capture patient information using the computer systems or the electronic health records. How does that come about? Okay, so let me go to same hands. The rest. I've told you that I'm paying key interest in contributions and attendance. So please, Joshua. Okay, Joshua, let's go.
Okay, thank you, sir. So please, sir, let's take a patient who has come to the OPD. So at the OPD, the patient's vital signs are going to be checked, and then patient vital signs will be entered into the LIMS or the GIMS. Then from there, I'll say this one is the collection of patient information. So after the patient's information has been taken from him or her, then it will be stored. So as they save this information that has been taken from the OPD, then the patient will go ahead to see the doctor. So the storing of the information is where I'll go in for the storage. So when the patient gets to the doctor, the medical doctor or in doctor who is present, then the patient will report his or her case again. But the doctor is going to rely on the information that the nurse has saved on the LIMS, because the doctor is going to take the hospital card and use that number hospital number to retrieve the patient information. So the retriever is where I'll say that the doctor will go to the LIMS, to the stored information from the nurse, and then get the information from the LIMS. Then when we come to the use of information and knowledge, this is where the doctor is going to base on his or her knowledge, and then will diagnose the patient, and at the end of it, decision has been made, and then the patient will go in to take the medication for the treatment, and then that will be all. So please, this is my small submission. Thank you.
Okay, so that's a very good submission. Even though I wanted us to take it segment by segment, but he has been able to, give a bit of somewhat explanation about each segment. So that is, a very good one. So let's also pick it from someone else. Regina.
Hello, sir.
Yeah, hello.
Yes, I wanted to say that it all starts from the records
Okay.
where the patient's biodata is taken. That is where they create a folder on the system for the patient. And
Okay.
this patient will be given a unique number that when you will enter onto the computer, it will just open an interface that is unique to that particular patient. Even a day born, when a baby is born today and maybe for one or two reasons the baby is not well and will need medical attention, a folder would be created for that baby using different biodata from the mother. So I think it all starts from the registration, where the patient's name is taken, date of birth, where he stays, telephone number, address, and I think it's most of the time one or two things are unique from different patients. Yes, that is the little that I had wanted to see. Thank
Oh, Regina, thank you. I think when it comes to the capture of information, he has done justice to that. And I think that is clearly understandable. So thank you for the feedback. You also have somebody who wants to add his or her voice to the conversation. Can we have one more? Can we have one more? Okay. Okay, so in the absence of, okay, Benjamin, Benito.
Hey.
Okay.
Good afternoon, sir.
Good afternoon.
Okay, so I would like to continue from where my sister left off. So with the collection of data, as she rightly said, we collect data from the client, ranging from the age, whatnot. So probably the patient might come into two folds, probably a new patient or an existing patient on the system. So after that, the records department then forwards it to the nurses station where vitals are taken. Then from where the vitals are taken, you see the hospital has different units. So probably at our end, that is in my facility, we have different units as we all know. So probably the patient is going to the patient is going to the dental clinic. The nurses do vital signs at the station, and then they disseminate these patients according to where they are supposed to stay. So if you're going for dental appointment, you sit at where the dental queue is. If you're going for eye, you go there, and then if you're going to the consulting room too, you go there. So after the consulting room, there is sharing of info. So probably on the system, someone complains of headache. The nurse might type into the system, oh, this patient complains of vomiting or headache, severe headache, and then probably the temperature value is attached to it. So we send this to the info. So we send it to the consulting room. So when the doctor uses the card and then opens the patient's folder or to crack, you might see that is sharing of information. You might see what the nurses also wrote, ranging from the vitals, and then during triaging, what he saw. After he cracks the patient, he also say keys in medications or what the next plan of action for the patient. So if the patient is to go to the pharmacy, there is also sharing of information. The pharmacy unit also gets their info and then they give the patient their medications. If they are also to pay anything at the accounts section, they also go there. So basically, that's what I wanted to say. Thank you, sir.
Okay, Benito, I think that's a very good feedback. That is a complete definition of what the key umbrella terms in informatics. So I think the points are very clear. He has been able to let us appreciate how these exchanges happen at the various departments. Okay, good one. So let's look at the capture of information. I wouldn't want us to deep into the concept of what electronic health records. We will treat electronic health records as a major topic. So we want to restrict our conversation to what happens within these umbrella terms. So let's take note of this. The first month of call is the records department. And in attempting to capture patient information, we just want to look at this as the initial step that the healthcare, information, the initial step in the healthcare information process, where it is very important that raw data about the patient are collected and it is now made available to the care providers. So I will define this one as the process whereby patient information is entered onto the computer system using the patient identity number or the OPD number. In electronic health records, we term that as the master patient index. It is a trump card or the blueprint within which the patient can access healthcare. So the first point of call is that you want to get your information onto the computer system. And that's why Regina was talking about registration, right? As you register the patient by taking demographic information, all of them constitute what we term as the capture of patient information. If you want to go deep into this, you will see that every department has a unique way of getting patient information onto their system, right? So for instance, we can also look at this one from this point of view. When you also record patient information or you enter patient-related data into healthcare information system for the purpose of storing the information with a view to retrieve and then maybe for clinical use, it is also an aspect of how we capture patient information. So these are within the views of, let's say, the care provider. For instance, the nurses have their own ways of capturing or recording patient information. Patients also have their own way of reporting their information to be unified with the electronic health record system. If you go to lab pharmacy, they also have their own way of doing that. And that is the capture of information. Then we come to the storage of information. Once you have registered the patient or the patient is enrolled onto the system, it is also very important you see how you can save the patient information. If these information are not saved, then the implication is that you may not be able to get access to the patient captured information or already recorded information. So it is very important that once you have entered them, you also save them so that we can access them for maybe future reference, right? Okay. And then when you also want to look at retrieval of information, it is also the process whereby patient already entered health information is made accessible to care providers using the unique identity number, that is the OPD number or the master patient index. So the process whereby patient already entered or captured information is made accessible to care providers using the OPD number. Please, I hope you are following the conversation.
Yes, please.
Yes, sir.
Good. So without the OPD number, when you have saved the information and the next visit, you want to access the patient information, you require the OPD number to usher you onto the system. Without that, you can't do. So that is also a very important part of what retrieving patient information. And then again, we also look at, the sharing or exchange of information, which is the process whereby patient information is made available to care providers using two or more computers in the sense that we are talking about how we can make information available to care providers generally. So you cannot rely on just one computer system to share information among care providers. The information you send, who is at the receiving end or who is the recipient of what? The information that is shared during the clinical relationship. So you require, several, host of computers to accommodate or, receive this information. So if you define your concept to mean that is, I'm making reference to the sharing of information or the exchange of information without tying it to computer systems, then it may be difficult for us to appreciate this concept, because if I share my information from the OPD, it has to go to the consulting room. The consulting room also have to make an onward submission to the laboratory or pharmacy. And that is why we are looking at different host of computer systems, right? To be at the sending or the receiving end of what? Those information that are shared during the clinical relationship, right? So it is very crucial, the kind of information that is shared during the clinical relationship. Very, very, very important, right? Okay. And then we're also looking at our presentation of information. Presentation of information, just as we are talking about the authenticity of, let's say, prescription, right? When you write legibly and then the clinician or the care provider can see what is written and can make some determination, then that can give a connotation about the presentation of information. Seeing the information display, the information that you view, the information that you see to make what decision. That is how the information is presented to you. For instance, the conversation we are having here, I've shared my slides. You can see the slides, right? They are legible enough. And that is also presentation of what? Information, right? So in your examination, we are going to draw different, concept altogether about how you can approach the key umbrella terms in nursing informatics, or let's say the information science. They are going to be more practical, right? And then you see how you can fountain the right statement to support, the right choice to support any statement or any question that will come. So let's take note of this, right? Okay, let's make progress from here to the next one. So generally, we have appreciated what the key umbrella terms in nursing informatics, which is tied to information sciences or information science. But let me pause here. If somebody has any question to bring to our attention, you are allowed to do that, right? If you have any question regarding information sciences, or let's say the key umbrella terms, let us know so that we can know what to do next. Okay, in the absence of questions or whatever, then I suggest that we make progress from here. So we are going to look at the types of our clinical information systems. Even though we have looked at information science, we have also looked at the key umbrella terms in nursing informatics. That is a major part of what our conversation. Now we're also going to look at the types of our clinical information systems. This one is more limited to decisions that we make at our various care facilities, right? So let me go to Dennis.
Sir, good afternoon. Please, my question is based on the key umbrella terms that you earlier indicated.
Okay.
You were saying that it focuses on collection, that is the storage, the retrieval, and the use of the information and knowledge per the definition. But in your explanation, you made mention of the presentation of the info as it being eligible. So with the presentation, where does it fall? Does it fall under it's being used of like its use of the information and the knowledge? If I don't know if you get my question.
Okay. So generally, if you are talking about utilization, we are looking at usage level of care providers in terms of what relying on this system we are talking about here. So if you want to talk about presentation of information, if you don't have proper view of visualization of what the information that is presented to you, you cannot make any determination or decision. So whether it is presentation of information as a standalone key umbrella term that is supposed to be tied to utilization, the net effect or the net benefit is what how best we can rely on our sound information to make what decision. So whenever we are looking at all the key umbrella terms, it is very important that in as much as we are looking at how patient information is captured, how it is stored, how it is what retrieved, and then shared, it is also very important we look at whether the system has also been designed to ensure proper visualization, or whether the system has what high resolution screen to support clinicians in order not to struggle in viewing those what content. And that is why we also want to look at it, that once it has been displayed, you can make sense of what the content that confirms what utilization, because you can rely on that word. Use it. But in terms of the categorization, we have tied them in terms of what the key umbrella terms. So presentation of information is what part, right? Even though we may not look at it completely as what how we share patient information, how we capture patient information. But once you can view, you can see. Because the people-based system, don't forget that sometimes clinicians struggle to what? See the content of prescription or the content in the folder. And that is why we are just comparing the people-based system and then the current system. So that is, exactly what I want to bring to attention. I hope that works for you, right? Is it okay?
Yes, sir.
Okay, good. So the types of clinical information systems. First one, we are looking at clinical information system. They are designed to support healthcare providers in managing patient information and improving clinical workflows. Right. So the general picture of clinical information system is that you want to look at the information system that is made available to care providers and how these support effective workflow across the continuum of healthcare delivery. We don't want information sharing to be truncated, or we don't want any interruption, but we want to have free flow of patient information in these kind of exchanges, right? And that is the clinical information system. We are going to look at it, in terms of components, where we look at electronic health records as the first type of clinical information system. It is a software, but this one is a major part of our conversation. So we can just have I will introduce this one in bit or in a explanatory way. This one is just meant to store patient information, medical history. So we can consider this as the type of information stored on electronic health records, or the types of data stored on electronic health records, right? And that is the electronic health records being considered or seen as clinical information system. So just as all departments are part of the electronic health records, we all understand. Okay. Then laboratory information system. It is also a unique clinical information system where all laboratory information systems are tied to this software, right? And then we also have radiology information system. Radiology is very broad, where we can look at the X-ray, we can look at ECG, we can also look at EEG, we can also look at ultrasonography and all forms of imaging studies. They are all tied to radiology information system. They are specialized system for managing medical data, right? So we can talk about the MRI scan, you can talk about the computer scan tomography, and quite a host of them, even though the advanced one has to do with electroencephalography, where this one, it is not just I mean, data is not just obtained locally. It is just made available publicly upon request. These are all very important part of what the geology studies, right? Okay. Then pharmacy information systems, where as at the moment, I will view pharmacy information system as one of the most active or important clinical information system in use here for the purpose of ensuring that our patients do not have to suffer because of what? Lapses in decision making. So management of prescription, and then again, any relevant information that the patient is supposed to know about this one is made very clear to care provider so that we are free from what errors that may affect the patient. Then the nursing information systems. So in computerization, nursing information system is also mean as what? Computer systems in what? Nursing, right? So they are the tools that is used to support nursing workflow, including documentation, clinical care planning, and medication administration. So one of the most important thing we may also consider has to do with, I mean, standard operating procedures for information management in nursing practice, where we are going to look at what documentation, but this will be presented to you for maybe further scrutiny in terms of presentation, right? Okay, so we also have for clinical decision support system. Clinical decision support system is also integral part of what we'll be looking at. In fact, there is a link between electronic health records and that of what decision support system. It is just a computer-based system or software that is meant to assist the care provider in making clinical decisions. This stems from the fact that the one who is cutting the path does not know behind him or her is what crooked or crooked. On the basis of this, we have designed these modern tools to ensure that it track the decision-making capabilities of what the care providers, so that any error that may go undetected, the clinician's attention is drawn to it through notifications or reminders, and then several prompts among others. So we are going to also look at how this benefits nurses or care providers what generally. Then patient monitoring systems, real-time systems used to monitor patient vitals, right? Even when the patient is not within the premises of what a facility, there should be a way to monitor their progress, especially diabetic patient and those with what BP, where we can look at what wearable technology in healthcare, right? It's also very important. Then we look at what telemedicine. These are also major. It's also a major topic to consider, where we want to go beyond the facility level, where we can look at what the services that may not necessarily have to be within the healthcare facility, but where we can also ensure that regardless of where our patients are, they can equally benefit from what the health services, right? And that is the essence of what telemedicine. So we are going to examine varying points of what telemedicine infrastructure or platforms and how they support decision making. Then surgical and then anesthesia information systems. This one is also tied to those the various theater. So we also be looking at this. Then emergency department information system, as the word suggests, emergency, right? All these are different software that are used for peculiar, purposes or tasks, right? So each type of what clinical information system plays a critical role in enhancing quality of healthcare delivery, right? So I'll pause here, then see whether somebody has a question from the types of clinical information systems. It is not just about question, but if you also think that you have something to add to further enrich our conversation, you are also welcome to do that, right? So you are also at liberty. You are not prevented. You can also go ahead and then ask your questions, right? Hello. Should I move on? Do I have your permission to move on from here?
Yes, please.
Okay.
Yes, sir.
Then that's fine. So let me just make progress from here. So we have looked at the types of clinical information systems. Now, somebody may also ask, why nursing informatics? This one will take us back to the introduction to nursing informatics, where it became very quite clear that we have witnesses massive challenges when it comes to decision making that has to do with relying on paper-based system. And as every sector is trying to progress to consider the integration of what digital innovations as part of decision making, it is also very important that we cannot also sit aloof. We need to also catch up with what the environment, a tremendous drive that is, causing revolution in all sectors. And these are the reasons, or these are the premises within which informatics is what built. Now, why nursing informatics? The first one is that it has to provide a nursing perspective. It reflects what nursing perspective. In fact, at first, nursing was considered more of what an art, but because of the deployment or integration of what this innovation, it is now considered as what science and what art. So these days, the dynamics have changed, where most of the research topics or the topics that were keenly considered is now featuring innovative or topics. So it is telling you that we are driven or moving a bit away from what, going into mainstream mode, nursing related topics or maybe health related topics. We are now trying to see how we can rely on advanced innovations to make what decision making very easy for all care providers. So this one has been there since the days of what Florence Nightingale, right? Because at the time in 1950, there was an attempt to use us quantum devices to see how they could manage what the weightier amount of information they had to deal with in everyday encounter. So that brought about those kind of what innovations, right? So it reflects nursing perspective. It also illuminates what nursing values and beliefs. So this one is almost tied to the first one, where these values have been deepened further since the foundation was laid very clear by Florence Nightingale, even though they did not live to see what we are witnessing today. But they laid very clear foundation that there should be a time, or a time should come, where it is not going to be the routine services, but we are going to see digital innovations that is going to drive or spearhead what decision making, right? So the question is that if you are faced with a voluminous amount of information, for how long can you continue to rely on paper-based system where information may be held in silos, information may look what uncoordinated or disjointed? So they made some predictions, and it has come to pass that we are now having a clear direction in terms of what relying on these sort of innovations. Then it denotes a practice base for nurses in health informatics. And that is why from the definition of nursing informatics, it became quite clear that the American Nurses Association, they have laid the scope that is seen as the guiding practice for all nurses. So it denotes a practice B for nurses in health informatics, where these are further, improved through inclusion of what informatics competencies as part of what nursing or curriculum, right? So at the diploma level, nurses do informatics. At the degree level, they are doing informatics. And even at the master's level, nurses are also doing informatics. And then nurses are also going into areas of specialty in informatics. It is my hope and prayer that as we want to take this modern technology delivery by storm, we need to also sit back and reflect that if we are going to focus more on public health, we are going to focus more on the routine program that we know at the expense of what relying on these modern technologies, then the impact that we expect to see at our various facilities will slow down. So we need to advocate for informatics competencies where these are earmarked courses, earmarked as specialty areas that we can encourage our nurses to specialize. It is then that we can see the massive explosion in terms of utilization, right? But if all of us are going to be pegged at the same level, the basic level in terms of relying on these tools to manage our patient, then we need to do more. We need to take steps to achieve more. Then it produces what? Unique what? Knowledge. Somebody will say uniquely what? Unique. So research shows that patient trust care providers who rely on modern tools or technologies to manage them. There are some patients, when they come to the hospital, even when they see you by your computer relying on this, they think that you know more WhatsApp, right? They have trust and every confidence when you have not even attended to them. Are you getting it? And that is why we need to treasure, this. Then it also distinguishes group of what? Practitioners. I'm yet to see maybe a discipline that has also introduced what? Informatics competencies, even though I know in other courses they are used, but as to whether it is being used like the way nurses have what? Integrated this as part of what? Informatics competencies, right? The courses they do. Then it also focuses on phenomena of what? Interest for nursing. This is a very interesting field. When you go to the major rules of what? Nurses in informatics, you will deepen our understanding of what? Why these digital innovations are very important. Then it provides needed nursing language and word context. Let me take my time to break it down this way. If let's assume when we did not have electronic health records, like we are witnessing in our VR facilities, decision making were just within the purview or left to the care provider to decide. And they are the reasons why we are designing these modern tools, especially decision support systems, so that whenever the clinician goes wayward, these systems are designed to ensure that they are brought to the right pedestal or path. In the same vein, per the level of training, I have been trained, let's say, somewhere. Another person has been training, let's say, I will go NTC. Somebody has been trained in another nursing training college, right? But when they come to the field to practice, they are coming there based on their clinical experiences, right? And experiences, one way or the other, could vary. But decision making should not be based on what? Assumptions, theories. It should be based on what? Evidence. And that evidence is what? Seen in unifying a well-integrated electronic health records that commit everybody to use what? The same system. It is not like I was taught this way. So let's say you want to follow a protocol. Then this protocol, maybe this how I was taught. No, there should be a unique system that ensure that all of us commit to what? Using that. And that is what? Nursing language and what? Word context. Your views are very important, but if you have any view, it should not supersede the unified system that we have. If you want your view to be admitted to the system that we have, then you have to go and then argue your case out so that your point will be taken care of in terms of what? Admitting as part of what? The system. And that is how unified systems work. Is that okay? Is that okay?
Yes,
I hope
sir.
you are following the conversation.
Yes, please.
All the things I'm saying here, somebody will just say that, but sir, the slide that we share with us, some of the things that we say, we don't find them as part of the slide. Then as I said, that is why you need to own it as a responsibility to make sure that you come and that you listen, right? And all the things we are going to do we are going to see in your examination is centered around the conversation you are having, right? Okay, so let's move on to the next point here. We have for healthcare informatics tools. Now, in order to involve you in the conversation, let me just pause here and then solicit your view in terms of the tools that you are working with. Those of you who don't have luxury in terms of what? Assessing platforms like most of you are now having access. Sorry that it is not happening at your end. But it's also very important that if you also want to understand these concepts very well, you need to also visit what maybe close by hospitals that are using these what modern infrastructure. My role as a lecturer is that I'm supposed to teach you, and then you are even lucky enough that we are relying on what LIMS and then games, so they are more accessible. But I want to make a profound statement that if I decide to go to Confanoche, request for them to give me their software to come and then teach my students, you will side with me that no institution will release a software for the purpose of what academics. Because of confidentiality, it will never happen. And I'm hoping that you will support the point I'm trying to make. And then the institution will say that they can also have its own software, but the software cannot be used without being tied to a facility, right? And then again, don't also forget that there could also be different versions of software, where somebody is using, let's say, games interface or LIMS or any other forms of software. In terms of application, it may differ slightly from one facility to another. So what we do is that we can have interfaces of the LIMS or the HAMS and then other software, and then I use that as well demonstration to guide you. But that one is not the ultimate, and that is the reason why I'm saying that go to the nearby hospital, spend some days there, just look at how decision making affect computerization, or how computerization affect decision making, right from the OPD through to let's say the last point of healthcare delivery. And it will serve your interest very well, because I'll be hearing that, oh, but these are seen as theoretical, these are not being demonstrated, right? So they are very important, but as part of your clinical relationship, or maybe the clinical attachment, those undergraduate students and those of you who are doing rotation, you have seen it all. Make sure that you are actively involved. I know in some places, some people may not even want to go near. All that they want to do is that they just want to just manage the patient without using the system. They expect someone to do it. So please, we all have responsibility to make sure that we understand, the course informatics very well. Right. But BBA fine. Why? Okay, so I'll pause here. Then get your views. Now let me go to Joshua.
Yes, sir. Please, sir, I have a question.
Okay, ask your question.
Okay. So please, sir, with the decision supportive system, with that aspect, is it that I want to use this example. Let's say a medical doctor want to prescribe medication for a certain condition, and maybe the health professional prescribed the wrong medication. Is it that the system is going to, in the decision supportive system, is it going to restrict him, or is after the health professional has done the wrong diagnosis with the wrong after the health professional has done the wrong prescription, the information will be made available, since we are using the LIMS or the GIMS, and then some other health professionals may have access to the information, and then they will correct it. Please, I don't know if my question is clear.
That is a valid question. You want to find out how the clinician know that the system has maybe corrected those errors that might be considered as oversight of responsibility, right? So that is why it is a software, right? It has been designed to take care of all these challenges that the care provider and another circumstance you will not have been able to report. These systems are designed to track the patient or to ensure that the care provider is always on track. For instance, you have something we term as information retrieval or therapy critiquing and then planning. Critiquing system. The critiquing system what it does is that whatever decision the care provider arrives at, it will also look at it and then compare it with the models that these systems have been designed or built on. So whatever is not right, or any decision that the clinician has made that is not right, the system will just search and then look at whether the decision is suitable, whether it is applicable. If it is not in line with how the system has been trained to respond to these things, then the system will bring those issues to the attention of the care provider, right? So the care provider will also have to weigh in. That's based on the option provided by, or the feedback provided by the system. You just weigh in whether to accept or reject the call by the system. And that is why I said that these systems are very important, but they should not be seen as replacement. If I have been critiqued that my decision is not right, then I need to also compare it with my experiences, right? And then based on that, I can accept to move on with my decision. Or if the system has presented the right call, then I have to refine my decision and then make the right call before authorization. I don't know whether maybe, but when you get to decision support system proper, you understand why these systems are considered as diagnostic assistants, where we have them as critiquing system and then information retriever, among others. All these things are being trained as part of the model. That anytime the clinician is going the wrong way, the system have been trained based on certain predetermined or predefined rules to bring to the care provider attention. Once you read the suggestions or the recommendation and it makes sense, then you refine your decision. Okay, it is not just to look at who is right and who is wrong. They are all partners in all decision making. Joshua, are you getting it?
Please say yes.
Okay.
My network went off, but I've gotten it. Thank you, sir.
So when you get to decision support system proper, I think this, point that you have raised will also be look at deeper, right? Okay, so let me go to Regina. Reggie.
Sir,
Okay.
sir, please, if I understood what you explained, for example, our patient monitors the SpO2, sometimes they will set it to maybe 95. So anything below 95, the alarm will just beep to
Yes.
alert the clinician that maybe the oxygen saturation is low. So maybe comparing to the patient situation, maybe
I think that's a very good.
the patient might be having a particular condition which the 95% or the 92 might be okay, but because the system or the machine has been set to above 95, the alarm will beep. So I think that time the clinician can ignore it or something like that, but all the same the alert was erased, if I understood what you explained.
Okay.
I
Okay.
think.
I think Regina, I think that's a very good feedback.
Thank
There's something called alerting and the reminding systems, right? So if the prompt or the alert become too many, that's where it brings some kind of confusion to the care provider, right? But these alerting or notifiers or notification systems, they are just meant to prompt the clinician to look at the order he or she has made, and if it is possible to refine those possibilities. Are you getting it? And that is how we have for these reminders being considered as features of decision support, so that whenever errors occur, what is the best way to alert or prompt the clinician? Unless you have features or prompts or notifiers, that is the only way my attention will be drawn to it, and then I make the right decision. I hope, Reggie, I hope it's okay.
Yes, sir. Yes, sir. Thank
Okay.
you.
Welcome. Now let me go to Agnes Agi. Agi.
So please, with the question my brother asked,
Okay.
I want to say something to that.
Okay, that's fine.
We all know that Adrenaline is one medication that we don't give as a routine drug. So there was one case we had. The doctor prescribed that we should nebulize the client with salbutamol and adrenaline simultaneously. So when we went to the pharmacy, the system has been designed that the pharmacist will not prescribe that dosage of adrenaline. The pharmacist will not serve that dosage of adrenaline to us. So the doctor had to come in to the pharmacy before they give those drugs and explain things. So I think that will answer my brother's question. The system will always alert you to know that you can't take this unless there's an external hand that comes in to let them know that they should serve or they should give or they should do that particular thing. Thank you.
Okay. So again, I think thank you for your contribution. I think it has also been very clear to all of us. But you made mention of what adrenaline injection, right? One of my guys,
Yes.
anytime you mention adrenaline, then it's like the patient will not survive. Anyway, so that is, I think we go deep into clinical decision support system. Into the why we are very fine. Okay, so I was also asking you about the tools in informatics, right? So what tools do you work with? So this one I mentioned them. One can be a video. Yesterday, I know I can be no who you. Hello. Let's speed up when I'm a time, no. I don't have to be going. Tuesday, me and Kasaminka, you need to see them. Okay, the chat page, I've seen computers. These are the major tools or enablers. The reason is you have made mention of computers, which is a very good one. But let me re-emphasize on this point. We are not doing computing. We are not doing anything IT. We are doing informatics. How we can rely on these digital infrastructure innovations to manage what nursing information systems. Okay, so it is just about how best we can manage information, but just that the computer system serve as facilitators or enablers, but that is not the only thing. Right, okay, so good. Then we also have for tablets. Tablet, I think they are all tied to their computers. Then internet is also a very good one. And then monitors. Okay, monitors, part of computers. Then Wi-Fi. Okay, fine. And then laptops. Okay, laptops or computers. What again? I think so far, that is what we can offer. So let's look at the tools in proper. Let's pay attention very well. You know, before the introduction of electronic health records, we used to have for standard treatment guidelines. And I think we still have it as part of what? Complement, right? Where you can see that as what? Reference what? Document. So if you want to, let's say, manage what? Upper respiratory tract infection, or you want to manage what? Sepsis, all these protocols are prescribed in the standard treatment guidelines. Then you follow the protocol to manage your patient. That is the standard treatment guidelines, evidence-based of protocols guiding nursing practice. So what a normal circumstance we would have relied on as well, the clinical guidelines. That is what is tied to the electronic health records. So we have transformed this, or we have transitioned from what? The manual system to what? Electronic health records. And that is why you see all nursing information system, protocols and everything being part of what? The electronic health records. Am I communicating to someone?
Yes, sir.
Good. So this one that we are talking about here in examination, you can see instances where you are supposed to confirm whether it is what clinical guidelines, whether it is what formal medical terminologies or computers, right? So let's pay attention. Then formal medical terminologies. This one, when you go to taxonomies and the informatics standards in Ghana, we will look at International Classification of Disease version 10. We look at systemized nomenclature of what? Medicine clinical terms. All these are very important, but the current system that is presented to us the question you ask yourself, whether it comes with what? Nursing terms, or whether the systems are unified with what? Nursing vocabularies or nursing terms. So at the moment, in some aspects, they will say that they have seen few glimpses of what that, and then others will also say that they haven't seen that. But when they get to the topic, then we look at it proper, whether the current system present what? Nursing terms or nursing, formal terms. So we have what? Informal nursing terms, and then we have what? Formal nursing terms. So for instance, if I talk about, let's say, asthma, right? Asthma, where on the system you will not see asthma being described what this way, like what? Asthma. You will see, let's say, chronic obstructive pulmonary what? Disease, right? But there's a way we can do coding or abstraction where we can assign a code that is considered as what? Nursing code or nursing term. So if I enter, let's say, ICD-10, let's say this one is the general one. But if, let's say, if I enter I-10, let's say I'm referring to, let's say, asthma. If I enter I-20, maybe I'll say I'm referring to what? Let's say hypertension, right? So when you get there, you look at whether these formal nursing terms are unified with these or electronic health records or otherwise. Then the computers are seen as the facilitators or the enablers. And that is why most people will conclude that informatics is about computers, because everything happens on the computer system. Okay. So we also have for information and communication systems. So those that we see as what? The servers, we see as what? The network, you see the routers. All these are what we term as what? Information and what? Communication systems. The internet, all of them are tied to what? Information and communication systems, right? Okay. So I'll pause here. Is it okay? Then let's go to the evolving technologies in what? Nursing informatics, or what I would term as what? Tools or technologies that have emerged or evolved due to healthcare or nursing informatics. Technologies that have emerged, evolved due to healthcare or nursing informatics. What have really fueled the need for nurses to also adapt to these what? Changing trends in what? Technology, right? That is the thing we are going to look at. So the one here is what? Computerized provider order entry, CPOE, or computerized physician order entry. They streamline orders for medication, test, and treatment. But these are specialized integrated systems that are designed for the clinician, within which the clinician has the capability of what? Making all requests. It is like all decision making emanates from what? The clinician's end. So what they rely on to the template or the segment they rely on in making determination or decision is what we term as what? Computerized provider order entry. It enables them to order for medications, request laboratory test services, offer medication treatment, among others. And that is the computerized provider order entry. Then we have also looked at what? Electronic health records. So if you see electronic health records, you can see the test results, right? Progress notes, where there's a digital tracking of patient progress and interventions. Nurses notes are also part for the purpose of what? Documentation. Medication records. All these are part of electronic health records. Now let's look at referral trackers. When you talk about the referral trackers, we want to see how best we can really ensure there's a proper referral infrastructure or system in place, where you don't have to manage one person using your computer systems or maybe your infrastructure that is, digitally oriented, and then you go to another facility and you have to go back to the paper-based system. They are not unified. So we are looking at synchronization, where there's a link between one facility to another facility to a system, and that is how we can track referral cases. But at the moment, the system that we have, they are not unified to ensure that referral cases go beyond facilities. They remain at the facility, but there was ongoing piloting study in Central Region, Savannah Region, to see how best they can ensure that all facilities come under one umbrella, right, or one centralized system or database repository. So that is, I mean, about the referral trackers, right? Then you also have patient portal. Let me just narrow this down to your level of understanding. I think we all have student portal, right? Do you all have access to the student portal?
Yes, sir.
Okay.
Yes, sir.
This enables you to log in to access your information, right? So in the same way that we also view this one as well, patient portal dedicated for our patient. But at the moment, this have been designed for the views of only care providers. It doesn't allow the patient to have direct access to their own portal. But as we advance, these systems should be made available or should be accessible by patient, even though they may not be able to make any input because they are customized. They may not be able to edit or make changes, right? But they can have a proper view of their records, right? So as it stands now, they have the patient portal, but it just remain at the facility or the care providers where they need to look at their portal and then manage them. But the patient do not own this portal. The care providers or the facilities own the portals on behalf of the patient. So that is the point. Now, blockchain technology, which is also very important. And that is the reason why these days we have for cybersecurity courses. These are very, very important to see how we can ensure confidentiality, to see how we can protect patient-sensitive information so that no information goes into wrong hand. If the facility doesn't take the needed steps and their digital infrastructure, whatever it is, get compromised, whoever has his or her record can take the hospital on. And that is why we need to deepen our understanding of the security protocols or measures that can be used as a way to protect patient information, right? The hacking, among others. So when we get to privacy, confidentiality, security, and then ethical use of patient information, we will also look at that. Then telemedicine, telenursing. I think looking at remote services or consultation, relying on this modern technology. So the key word that defines telemedicine or telenursing is distance, where you may not be physically present, but you can be managed using these advanced technologies, right? Then artificial intelligence is also one of the emerging or evolving tools that have also brought almost every sector to its news to see how they can, look at the benefits of AI in supporting decision making. So as part of what NMC recently included in nursing curriculum as part of informatics, we are to look at the benefits of artificial intelligence in nursing practice or for nursing practice. So we will not go deep into this, but we are looking at how we can, obtain some benefits in terms of relationship with decision making. So AI is very important. They are not seen as replacement. So I will say that even though people try all means to maybe rely on AI to do the assignment, do all that, but AI cannot do everything, right? And at your level, even though I will encourage the use of AI, but you should not use that as a major shift in terms of decision making. If you understand what you are doing and you understand how to apply these AI, using them responsibly, being guided by ethical principles, then that is a very good step. So that is what maybe people have been using it to do. But when you want to talk about how the healthcare facility can benefit from AI, then we just have to move away from the center stage in terms of the topic dominating or taking center stage of communication. We need to go deep into how we can exploit AI tools to support or predictive decision making or predictive analytics. So let me just say something small. You train a model, right, where the model will be able to make up predictions. It is not just training the model. You need to go through several pre-processing phases, right? Then as you train the model will be able to make predictions. And when it confirms those predictions, then you apply them. It can support any intervention. And that is what AI. So you need to go deep into coding. Understand, because it is through coding that we can be able to make predictions, right? So that is it. So I'll not take you deep into going into deep learning algorithms, looking at random forest among others. But let's stay here. We apply the benefits only. Then machine learning. Machine learning is for predictions, especially for diagnosis. When the clinician is faced with what? An uphill task in choosing a complex or diagnosis, these models can be trained, and then we can predict the diagnosis and then its what associated with healthcare outcomes. So machine learning and artificial intelligence work hand in hand. Machine learning is what? A subset of what? Artificial intelligence, right? Okay, so I think I'll have to pause here. Then if you have any question, then bring to my attention. If you have any contribution, you are welcome to do that. Mejidi said you are not sleeping. Say move follow there. Okay.
Yes,
Dennis,
sir.
good. Dennis, can we hear you?
Yeah.
Okay, so I have some issue with respect to the referral trackers.
Okay.
In the sense that in Ghana here, if only we want to do it, definitely we can do it. Because I remember this limbs or DIMS that they are using. It can track the amount that you are owing. If you owe in, I think, one hospital and go to the other hospital, they can track that you are owing an amount. Because I think one of my uncles, and he's an accountant at a government hospital, and he was telling me that this new software that they have brought, they can tell that you are owing here. So in a situation whereby you have gone from the hospital and you think that you are free, when you go to the other hospital, because they are using that same software, they can know that you are owing. So I find it difficult to apprehend this whole issue that Ghana here, why can't we do that? Why can't we work on this referral trackers? Because in as much as we can track finances, why can't we do something that can also help in improving patient health?
Okay. Okay, that's a very good enlightenment. And then maybe I also view it as question. I think that's a very good one. But sometimes they also tell you about resources, right? That is why I made a statement that there's ongoing piloting project to see how they can unify all these systems. It is not just about just unification, but before you can take that step, you ask yourself whether you have the requisite infrastructure to support these referral systems. There should be a well-integrated or deeper data repository center where that is mined by experts so that they can be tracking all the services or maybe referral cases. At the moment, we can use our internal system to track patients who have defaulted in payments, right? Where we can know, because until they visit the facility, those arrears in their records still remain the way they are. When they have not settled those arrears, there is no way the system will allow them to carry on with further services until they have settled all of them. But these are done internally. But we are looking at how we can advance from the internal trackers to an external trackers where we can track or we can have a unified system, so that even if I've been going to, let's say, a facility and I decide to even go somewhere, all my records will still be there. There will not be any need. Okay. And that is the conversation we are having. So we will view this as a contemporary issue or challenge affecting nursing informatics, right? But you need to also, it doesn't come just like that. It is through some steps or processes before we can also ensure that every facility is on the same system. So Ghana Health Service has started, something small in gradual steps. But let's see how we can witness widespread adoption, right? Is that okay? Yeah, entry. I don't know whether I've answered you.
Yes, sir.
Good. You know, this conversation we are having, if you look at the history of what informatics, the conversation we are having began somewhere around 1970s coming onwards. And we are now looking at it. So they have gone past what using such system to, at the moment, the electronic health records is to manage what workflow, but we encounter a lot of challenges. They have gone beyond that. So they have integrated what AI tools or elements. I think in 2018 thereabout, America introduced a clinical decision support system, right? When they introduced telemedicine in 2016, they also introduced clinical decision support system in 2018. And the kind of what impact it has what made. That is why I'm saying that we need to manage it what incrementally, okay? So maybe as we began the conversation about electronic health records, and we are completely move away from paper-based system, I think a time may come, we will get there. But we need experts to support these transition processes. So you also ask yourself, who are the experts who will also ensure that they are supposed to be manning, or they are supposed to be stationed to ensure they do this. You are your own information. You should be your own information management expert, and you don't expect somebody who is not inclined to the things of what nursing to manage your own information. So be ready to get the needed expertise to support this worthy cause. Okay, anyway, I think I rest my case here, right? Any question, any further question, or I should move on? Should I move on? Okay, now let me go to Ben.
Yes, sir.
Ben.
Sir, please, my question is with regards to the information management system that you showed. That was just on the screen. So with my facility, within the last year, within just the last say 1 year, say 1 year, 5 months, we've used about 3 systems. At the beginning, when the new government came into power, we were previously using the LIMS. Then they decided to cancel it, and other facilities started using the games before it came to an end. So we went back to the old system, the HAMS. And then we currently moved recently, just at the beginning of the year, to the games system. So I wanted to ask, how can we merge, say, let's say, patients' info into one broad data? Because it seems that all these informations are dispersed. Like, this patient comes to the hospital previously, and most of them has like 3 different cards. Especially the old ladies, they come with 3 different hospital cards. The person has the LIMS card, the HAMS card, and then the games, the current games card. So how do we integrate all these into one system so that probably after like we've shifted from the games, that continuity of care continues properly? That's my question, sir.
Okay. So that I think that's a very good observation, and this is very, very critical because you cannot set up patient to be on the software, and then there's a sudden change to use new software. What I can say is that, except that maybe there is reported cases of compatibility issues where it becomes difficult for care providers to use. That is how maybe you change the software, or you want to update it. Changing it completely, leads to a lot of issues for care providers who may need to also go through new phase of training, which may be something of a challenge to care providers. So at the moment, I think we need to be more deliberate about what you want to achieve as a country, where we think that if you have a software, the only thing that we can do is that you're not supposed to completely replace the software. But if some of the features require to be updated, then we can do it without affecting the original structures, in place. And these are maybe top level decision making. So sometimes you may not have definite answer or insight to provide, except that maybe if the earlier software, the LIMS were giving you some challenges, or it brought about some compatibility issues, then that is fair up. But if you have been able to institute a new software, brought on board new software, that is the games. Going forward in future, we need to ensure continuity of care and consistency. Then consistency call for maintaining the existing system without completely doing away with it. And that is the only way that maybe we can march forward and achieve something big. So for this one, top level, decision making. So I wouldn't say I cannot be in anybody's shoe to make decision, but that is maybe my view. Whenever you want to set up this infrastructure, you have something called interface engine, and you also have point-to-point interface. The point-to-point interface rely on some few selected departments, right? And that is why when you were starting rolling out the electronic health records, you notice that you need to begin with some few departments, right? When they have worked, then you make it more longitudinal, and therefore it will bring on board a whole complete software to manage that. But the interface engine, that is more complete one. It can take many departments, or it can even go beyond our facility. But a point-to-point interface is just limited. So if maybe you introduce point-to-point interface in your facility, and it is raising concerns of incompatibilities, then you need to switch to maybe the interface engine, where it can cater for several departments. But that is not what maybe I view the new changes to be like. This one is top level decision making, right? They said that they were launching investigation into the previous ones, right? So for that one, it's more political, but I wouldn't want to go deep into anything, right? So let's leave it here with the view that we are hoping that things will be okay. But I sympathize with you, because you cannot be using one software, then you switch to another system. Then it's like you are throwing everybody back and off just like that. I don't think that will help. So maybe ask your management what software is ideal for your facility, and then ask them questions. Why did they begin with the HAMS? Then they moved away from HAMS to LIMS, and they have also moved back to games. So when you go for internal meetings, ask your facility management why the changes, and then let's see the answer they may also give you. Right. Okay.
Okay, sir. Thank you very much, sir.
Okay, good. So can I move? Okay, now let me go to Ima.
Yes, sir. The question that you just asked, I just want to clarify some things there about the change in different softwares. We were currently using the HAMS, and I thought I was saying that hearing the HAMS was private, okay, and then most of the facilities were using it, and then other facilities too were using different softwares, which was the LIMS and then the HAMS. They combined it. So the country came in a memorandum that we wanted to use the HAMS, the LIMS, okay? And the change of government, when the NDC people came, they were not paying the providers of the LIMS. So they started taking their software. What you are there, and then they will hack your the server, and then you see that the software will not be working again. So they've now sat down to introduce games as nationwide software that maybe I don't know whether they are also going to change that or they will maintain it for a very long time. So as currently, most of the government institutions or government hospitals are now using the games, and then even the number that you are using in a different hospital, you can use it when you go to a different district or different region, even the same number, you can still use it and then you get your information. That is on the games, and that is what they are saying that they are doing. I don't know how far they will take us, but we are praying that they stick to one software to in order to help our patients. Thank you, sir.
Okay, so what you have said, I think you have given us a complete picture. But that is why even if you are using LMs, a call for extension, right? If you want to ensure that they are unified across the country, if they are used internally, then you think of how you can extend or make it more widespread so that we have a complete architecture for the whole partners. But as to whether we can maintain this going forward, that is also a question, because if there's also maybe change in government, and they may also want to investigate the activities, whether it can also call for new replacement of a software or whatever it is. So for this, let's leave it in the hands of the decision makers, right? But the challenge there is that the disgruntled, staff, we are worrying them and they're worrying our patient. That is the challenge that I have, right? Because in as much as I'm using LIMS, maybe the games interface may also differ slightly from maybe LIMS, and I have to be exposed once again before I can utilize all the features. And these are the setback, right? But let's see, right? Okay. Ima, I hope you're okay.
Yes, sir. Sir, I'm okay.
Okay. So let's look at the goals of nursing informatics as provided by the National Center for Nursing Research. In as much as we have looked at whys of nursing informatics, the Center for Nursing Research also set some 6 primary goals for nursing informatics. And let's look at them in proper perspective. The first one is establish nursing language, useful in computerized documentation. Now, we wanted to have a system that ensure that we all use the same system wherever you go. So this has even resurrected the conversation that we have been having about how can't we use a unified system that ensure that everybody is on board. I think for that one, when it comes to electronic health records, we have been able to achieve some common grounds where we have a software that ensure that we don't place decision making on assumptions, but everything is based on the system that we have, and that is a good one. Then develop methods to build clinical information databases. So you may have database infrastructure. We may also have workstations. So if you look at the facility, it seems like every department has a small database or workstation that is created, in as much as we have the bigger database infrastructure, because they are segmented. You need to have small workstations, and these workstations are something like computerized system that is placed at vantage point for managing scientific and technical purposes. So that one is limited to the facility, the department. Then the database infrastructure is the whole architectural framework for the facility. Then determine how nurses give patient care using data, information, and the knowledge. We want to define our understanding of how we can provide our patient with quality care, relying on data, information, and knowledge. And these are very important. They are tied to the electronic health records. Then develop and test patient care decision support system. I've already spoken highly about decision support system, where I said that it is meant to complement the clinical clinician decision-making capabilities, right? Then they develop workstations that provide nurses with needed information. So the workstations are placed at vantage points that serve as a database to support nurses at decision-making. Then you also want to do evaluation whether the current setup is meeting the needs of users or otherwise, right? Right. So I'll pause here. Then, as we are clenching to our time, maybe take 1 or 2 points from what you see to be the benefits of using electronic health records, even though we have expressed this as part of what last week conversation, paper based and yeah. So please let me hear you. What do you see to be? We have some few minutes to go, so please. So let me hear from Becky. I've seen rep. I've seen Becky rep. I've seen another rep, but I don't even know you. So after this session, introduce yourself proper, right?
Okay. So good
Okay.
afternoon.
Good afternoon.
I'm Rebecca Keta Rep.
Okay. Good.
Okay. One benefit from the system, what I have said, that it makes work faster and easier.
Okay. So can you tell us more about how it make work faster and easier? Can you open up a bit?
Okay, unlike the folder, when the patient comes after the clerk from the consulting room, patient brings folder, you have to cross check and everything. This one, because it is just one system, when you go on the dashboard, everything pops up there for you to see. Then you also cross check your medications, and then you administer your medications and type in everything. And also, the reason why I said it's even faster and easier is that at times you can do copy and paste, then you edit.
Okay.
Let's say you have 3 admissions at a go. When you are writing admission notes, you can just copy. After writing the first person's report, you can copy from that place, paste it on the second person's dashboard. Then you just edit the vital signs or the most important things that you need to edit. Then you save.
Okay. I think Becky, that is a very good feedback. Because the system have been customized or designed, so it limits what manual documentation, right? So it's expedite
Yeah.
decision making. I think that's a very good one. Now let me go to
Yeah.
Comfort. Can we hear you? I saw your hand. You have run away with your hand. Come back with your hand, right?
So I'm not done. Another
Becky, okay, you want to carry on?
Yeah, another one also, it helps us to prevent making errors.
Okay.
Just as some of my colleagues said earlier about medication documentation and all those things. So error making is less.
Okay. I think okay. So somebody was that's a very good one. Somebody also said that it helps keep and store patient information, ensure proper continuity of what care, store patient data better. Okay. I think do you have one more or it's okay?
So please, it's okay. Let another person continue.
Okay, another person, one person more, then I think we have about 4 minutes. Okay, so let's look at this one. The positive impact of what nursing informatics. This one, normally, whenever I'm even teaching, I hide them because you have been using the system and then you should be able to tell us how you are benefiting from what the system, implementation. How is it serving your needs? Now, let me go to David. Dave.
Yeah, good afternoon, sir.
Good afternoon, Dave.
Thank you for the opportunity. I want to also say one benefit concerning this electronic system that we are having. It helps to retrieve the patient's folder quickly. I mean the electronic folder quickly, because with my experience, I realized that most of the clients, when we were doing the paper, or let me say the folder system, that's the paper system, some patients can even misplace their ID cards or the patient registration card that we have been giving to them. They will misplace it before coming to the facility. By doing that, we find it difficult to get it. We have to take the the OPD registers, go through it before we can be able to get their OPD numbers and retrieve the folders and attend to them. But by having this system now, all these things have reduced. Thank you.
Okay. So I think that's a very good one because this one look more coordinated, and therefore decision making is done more effectively and then efficiently. So I think that's a good one. Okay, so let's look at these few ones. Improve overall patient care. That is the ultimate goal. When we introduce any system, then we are saying maybe that system is what characterized by some lapses or challenges, and therefore the new system should be able to improve upon that. And that is the ultimate goal of what? I mean, informatics, improve patient care. And then I can also want to facilitate communication. And communication is built on collaboration, right? Teamwork. So we have a system that supports effective clinical workflow. That is also another point. Then better decision making, and then reduction in medication errors. We also want to streamline documentation and ensure enhance records keeping, facilitate evidence-based practice, and then support patient-centered care, enhance data security and privacy, and improve outcomes through predictive analytics. So with the challenges, maybe time is up. So in another meeting, we look slightly at the challenges, then we go to this one. We need to speed up because you don't have much time. So next week you have to speed up. Okay, I'll pause here. Then as you are drawing curtains to our meeting, do you have some few questions or anything somebody want to bring to my attention? Then we end. Is there anything somebody want to bring to my attention? Okay, now Ima.
Please, from the timetable, it looks like the time is rather 3:15. I don't know if we are having a different one. Pardon me, sir.
Oh, is that the case? I'm not aware of it. Okay. Is
Yes,
that
sir, please?
Hey, there why am I not?
Yes, sir.
The one who sent me the timetable, is that what you sent to me?
Yes, please.
So we are to end when?
Please say 15.
3:15.
Yeah. Please, I'm gonna
Yes,
some comment.
15.
Hey.
Let me confirm again.
Wow. but next week you didn't tell me this. Next week, I think I ended around the same time, 2:45, right? And we didn't want to. So what did you?
Yes, please. It's 3:15.
So why didn't you prompt me last week to? I mean, go further.
Oh, we thought you were tired.
Yima, I'm asking you. You said you
Please, sir.
We are tired.
Please, sir, that was the first time, so I thought maybe it was just an introductory. Then,
I was normally what we do is that most of our lectures have been 2 hours. So I plan my mind that we're going to spend 2 hours, not knowing that 3:45. I didn't look at the timetable. So we should carry on, right? Okay, so let's move on to maybe by 3:15 I'll have to end. Is that okay?
thank you, sir.
Yes,
Thank you.
yes, sir.
Yeah, so that next time when I come, I'll have to prepare my mind very well before I come. Okay, so let me also pause here and then now let's make it more interactive. What are the challenges that you have been encountering at your facilities when it comes to the use of what? your software, what challenges do you encounter? So recount to me the challenges. These are not part of what the slides. Sometimes I prefer that you make this more interactive. So bring out your views. Sarah.
Yes, sir. One of the challenges is with network issues.
So as you read the challenge, then you tell us what you think should be done to get it resolved. Going forward, what can we do to improve our network situation? Do you have any insight you want to share with us?
So we have like an team that is almost available all the time except weekends. So when we have issues like that, we just let them know. Then sometimes we get it rectified fast, and sometimes it's slow. If they are busy, we don't get it as fast as we want, but most times they're able to deliver on time.
Okay. Well, I think that is a point and a feedback. The point you are raising, yesterday I was even at MTN office and I was even activating something, but the network was not stable. And I said that even at MTN office. But anyway, then somebody has made the point that over changing of our software lead to what? Information loss. How? So we'll get very fine. Why? Okay, so let me go to then somebody for that one. If you raise issue about doing so, your facility has come of age. They should be able to procure hot. Some plant, right? Okay. So Jemima, can we hear you? Then I'll.
Say yes, please. Sir, please, good afternoon. My is I think just 2 days ago, I was here at the OPD and a patient came in. According to her, she was here on February to deliver, so it was through cesarean section, and she had been discharged around that time. So she came in currently with minor lacerations, which she needs to activate her card and then come for her dressing as scheduled. Now, she gets there and the system is telling her she's still on an admission. And honestly speaking, patient was frustrated. She didn't know what to do. She needs her hands to also be dressed. She was pacing up, and so I told her, okay, we will get to the team. But first, we went to the record, and they also said we have to go back to the recovery ward where she was first admitted after the cesarean section, because on the system it's there that she's still on admission at the recovery unit. So we went there and they also tried their best. They couldn't really resolve the issue. So we have to come back. And since the team were not in yet, we have to let them fill in this paper. We have a name, we give it. So I asked them to get her one. Then later on, we deal with that later. So that's one of the challenges I've also observed recently. She's not the first person. Actually, there was one. And another challenge is when a fee is being paid. You realize that it's still, some of them, the amount is still there. The amount that they had already paid is still on the system. And so they come and you tell them they are owing, they are like, no way. I paid this so and so and that. So we have to alert them. Patient has to go and bring in receipts, for them to take it up there. So that is one or two challenges that personally I've also observed. Thank you.
Okay. So I think that's a very good point. As we are even enjoying social media platforms among others never live to see, what we are seeing these days, right? So in as much as we have also begun our journey, don't also think that it may not also come with challenges, right? And some of these challenges we are talking about here, maybe we have to go and then maybe others who will come in will also, maybe things will be stable, but not yet. The point I'm trying to make is that it is not right to be using paper-based system alongside what the current infrastructure that we have. Once we have decided to go paperless, then it should be paperless, right? But because it's a new software, it will come with what? Challenges. So when the challenges come and then it is beyond our control, then we have no option than to go back to the paper-based system. So that is a critical challenge that we are supposed to deal with, right? And then again, you also made point about, please, what was the second point?
Please, fee paying, bills.
Yeah,
Sorry, bills.
I remember in my facility, for instance, when they have managed the patient, then the software, put everything together to say that the patient was supposed to pay something around 30,000 Ghana cedis. 30,000 Ghana cedis. So just imagine. Okay, so these are some challenges that has to be looked at and then face it. Get it faced. So I think just report to your facility management and then see how they can deal with it. Because if I have paid, why should the system charge me again? It doesn't have to happen. Okay, so thank you. Now let me go to Sandra.
Sir.
Okay.
Good afternoon, sir.
Good afternoon, Sandra.
Please, one challenge I've also observed is when they are doing updates, it takes a long time. And sometimes our patients work and you don't want to attend to them. And you know them. They wouldn't understand even when we explain to them that it's not our fault. It isn't that we don't want to attend to them. But once they are doing an update, there's nothing you can do about it. Thank you, sir.
Okay. So I think based on what we are saying, that update, that is why it is very important that they do the updates at night when we have for fewer patients present. You don't do updates. Then are there in their
They
numbers?
don't do it like that. Most of the times I've been observed that they normally do it on Monday morning, then they are doing updates, and the whole facility is on standstill. Nobody is working.
That's not how it's supposed to work. Maybe they need more hands because you may also have for just one or IT guy. If the person is on leave, one person cannot be coming back and forth just like that. So there's something maybe you can report so that the system become more stable for you, right? Okay, then from the chat pitch, ECG power outages. For that one, tell your facility to procure, you have come of each. So the internally generated funds, tell them to support you by procuring some of these things, right? Are you getting it? Okay, and then again, I've also seen inadequate computers. So I don't know whether maybe one of this you haven't provided solution. So the solution is that maybe you may want to sacrifice part of your salary to procure computers. So you didn't provide solution. Then patients who are financially challenged are not able to access care because they have to pay after every service. That's also a challenge. Okay, so I think you know the challenges that you are encountering, but not that they are bad. They are good because they are there to make sure that we improve or we excel. So let's see how we can rely on these challenges and then improve the system, right? Okay, any further concern? Any further? Okay, so issues of discharges, right? Jimmy, okay.
Sir, please, one more question. Please, you also realize that sometimes the even though the network isn't working, however, the insurance network is really working at the side of the records. But the non-insured, the non-insurance, you go and they are able to access the system for you. But with the insurance, the network will be misbehaving a little bit. Forgive me for my language. You realize you go there and they are telling you insurance network, chuma. So I don't know if it's pertaining to the games or if this time around is from the insurance company. It makes patients frustrated. Onisika, about insurance. So he or she thinks the insurance will be able to help him or her at least to activate the card. Now the person comes in and you're telling him or her that the insurance doesn't work, the network is not working. However, the non-insured, well, with non-insured, they can push through the system. It means they have to pay everything cash and carry. And it makes them really, really frustrated. You see, they'll be talking, going up and down, rather than the OPD nurses. They're on our head. So I don't know this one where exactly it comes from. Please, could you help me with that?
Okay, for this one, that is why I see this one could be management, level issue. Why, when you notice challenges beyond your level, you just report to what management. If management maybe also have answers to maybe your question, they also make it known to you. So maybe there may be some technical issue somewhere, right? That is not known to the staff, but management will be aware, or the system administrators, the IT people, they may also be aware of the challenges where they are emanating from. And if they have reporting system in place, you also do that. But for this one, I think technical issues, it needs further, scrutiny from the hands of what? The management, right? So I think that is what I can say. But let's take note of this. Before you set up any infrastructure of this sort to run, first of all, they have to assess your readiness to ensure uptake of what this sort infrastructure. But if you set up the system and the system introduces what a lot of what issues, then somebody will ask you, how did you do your initial readiness assessment? And that is what that is why we do phases of system implementation. So you take into consideration whether the system will be able to thrive on an environment where we have what unstable internet connectivity. Then another school of thought will also say that it is also better to start and then have some challenges than to just rely on the traditional system. So I'm just of the view that, as part of developing country, when we introduce software and then those kind of stuff, it will raise some number of what issues. But as and when it comes, then we should be able to find solution to those problems. So let's manage. But what we think that is beyond our level, let's report to management or the system administrator and then find answers from them. I hope you are getting it, Jimmy.
Yes, please. Well noted.
So, Ima, I think let's wrap up and then I'll go to the applying nursing informatics to nursing education. I'll have to use 15 minutes to do this.
Okay, sir. I just want to clarify this thing. The insurance network is sometimes it's even beyond the control of our superiors at the hospital, because when an insured client comes to the hospital, you need the network is different from the software's network. That one must be generated by our MTN or Vodafone. There is something called CCC code, claim check code. So that the insurance will develop a network that you go and claim, and they will just give you a 5-digit number, and then you put that number on the HAMS or the games or whatever software that you are using for the software to know that this patient is registered on an insurance. So if that network is not working, even your doctor or your medical supervisor cannot even do anything about it. You just have to wait for the network to come, or you go by the cash and carry way, or it's just like you want to make a call, but MTN network is gone or it's not working. So that one, it still boils up to the network issues, not the problem with the HAMS software. Thank you.
Okay, so Ima, thank you for the insight. But the point here is that I don't want the professional, or let's say the staff, to have to go through these challenges where these are top management issues. So for instance, per the insight that you have shared with us, if it is MTN, it is just about the insurance network problems, right? It doesn't have to take the staff to go through all these challenges. That is why we have the reporting structure there. Go to management, and the management will give you proper perspective why these things are happening. If they're able to explain to you that these are beyond our control, then you can feel more relaxed, right? Because when you are being pressured to take decision, sometimes it can go, a wrong way. So I don't want us to battle ourselves with the fact that we have to do something. Whatever happens within the facility, we need to report to what management. If it has to do with what network issue, they also have to what deal with what those people at the top, and then see how we can. Because going to obtain, let's say, a code to put it on your software to see how maybe it can offer some stability. This one, the care provider or the staff doesn't have to go through all this. Management will have to what, feed them and ensure that the system is stable for effective workflow, right? Okay, so thank you, Ima. Now, applying informatics to nursing administration, research, and clinical practice and education. But before that, I want us to look at this one. I want us to look at this one first, and then I don't think that is here. Let's look at this one before we look at. So we are going to look at rules of what nurses in informatics, right? Rules of what nursing in informatics. Even though we'll be looking at what applying nursing informatics to nursing education, nursing research, nursing administration, and then nursing clinical practices. But let's look at what the rules of what nurses in informatics. The first one is what user liaison or liaison officer. User liaison or liaison officer. You list up or team up, right? Then product manager, clinical systems installer, system analyst or programmer. And then other rules of what nurses in informatics include chief information officer, nursing informatics consultant, network administrator, data repository specialist, nursing informatics project manager, nursing informatics educator, and clinical informatics or liaison. So these rules are very important. And this one will take me back to the fact that I'm proposing or advocating for inclusion of informatics competencies as part of what the study leave programs that are mounted every academic year, where we may need what ophthalmologists, we may need what public health nurses, we may need what emergency nurses, we may need all other forms of what specialist, attention or care. It is also very important that the very useful tool that we are working with, we cannot underestimate or downplay its importance. So it is also very important that this one also receive the needed recognition. It is then that we can really use the system very well, right? Now, the first one, if you go to advanced countries, nurses are managing their own information systems. And that is why I said that ownership is what a major setback when it comes to contemporary issues of what nursing informatics in Ghana here. Why do we have to treasure our own software for somebody who maybe we cannot associate ourselves with? When I say associate ourselves with, I think you have to understand. Why should somebody who doesn't, form part of the fraternity, own our software? And this is what a major challenge. Nurses do not own their own information system. So information look what disorganized, disjointed, or fragmented. But we want to see how we can have nurses who will be trained as what liaison or user liaison, who will be able to lace up with the vendors who sells or maybe who design the software, who provide the computer and then associated with accessories or maybe applications. We should be able to be used as an intermediary between the management and those vendors, right? So you go to the open market, get in touch with those who design the software, because you are also expert in the field. You should be able to point out the nature or the type of software and how those software should be designed to include the needs of what users. So you hear of what any thing, maybe any software that like you're talking about like games, and then this what let's say the software that your facility want to use. Go to the open market, negotiate with them, give them the components that you want to be part of for the software, and then they will design that and then you come and then convince management why you think this software is fit for purpose than what maybe the other ones. And that is what you do. You lace up or team up with what the expert, okay, to facilitate or spearhead what implementation of what this or software. Then product manager. Product manager, your role is that it is in semblance with what or in tandem with what the user liaison. Your role is that you constantly update what management about new trends of what technology or new, evolving technology, right? And then you convince management why they should go in for what that software or that technology. So you should be expert where your ears should be on the grounds, looking at what emerging software and associated applications. For instance, we are looking at what blockchain technology, right? Where you have introduced a software, but you think that you don't want the system to get compromised, and therefore you can enlighten management that we have what audit tree systems, right? We have what multi-factor authenticator. These are emerging software that is what pushing Jennifer. Jennifer for us. So you convince management why you think that you need this software to beef up to ensure that your system don't get what or doesn't get what compromised. So you always have to be on the look, be on the grounds, and then any emerging software or technology that you think your facility may need, then you go to management and then you tell them more about that, right? So that is it. Then clinical system installer. You have system phases of what system implementation. So you should be deeply involved through that the procurement of what the software, setting up what the infrastructure, supporting the full functionality of what the infrastructure that you have mounted. And then again, maybe after the operationalization, it is also very important that you do evaluation to see whether the needs of what or maybe your expectation have been met regarding the new software. So that is all. The clinical system installer to install. You are involved in decision making to procure the software when it comes, how to set them up to run, and then ensure that they are compatible and then free of all challenges for users. You have to be more involved. Then system analyst or programmer. You have to ensure that the system you have programmed the system, you have customized them, and then again, you are able to ensure that there is easy stability or stable flow of what information across the continuum of what healthcare delivery. So, for instance, you can be stationed at one end. Your role will be or your task will be that ensure that the system is stable to support workflow. So it is not like we have to go to the system administrator alone to ensure that. No, once we are going department by department, then there should be somebody who will be tasked to ensure that the system is what running efficiently and then running as expected. So you program how you want things to work. Run the workflow, all other relevant information that you should have. It have to be there as part of the programming process, and how you can communicate or share those information through workflow, right? So that is just a bit about the major rules of what nurses in informatics. And these days, I've seen nurses who are also taking master degree courses in informatics. Others are also, I know some students who have, reached out to me, and then we have had open discussion about this. Some of them are also doing masters in informatics outside. Others are doing direct work nursing informatics, right? So that is just, it is then that we can witness what that massive explosion or evolution that we want to see. We say we are in the fourth evolution industry, and therefore we need to make sure that we are part of what the changes, right? Okay, so I'll pause here, then see whether maybe you have for some few questions or maybe any further comment to make. Then we look at, then the time is even up. Then next time we look at how is there anything? Okay. In the absence of what? Any question or comment, then let's be guided by what? I want you to go and then read around this out the page. Then I'll mount the slides for you, and then so that you can read the rest ahead. Applications of nursing informatics. You look at nursing clinical practice, which is also the point I want to establish here is that these technologies are deployed not only in clinical settings alone. The conversation that we are having is an instance of how technology is supporting nursing education. The various webinars, Zoom meetings, Teams, whatever it is, any platform that is, technology enhanced system or platform. How nurses are benefiting from that. That is what we term as what how technology is what helping nurses in what. Talking about harms, you're talking about that is applied to the clinical settings, being it the type of what clinical information systems as I espoused earlier on. Then that is also geared towards what the clinical settings. So let's take note of that. So what we are doing, we are facilitating how these digital infrastructure to support what nursing education, and then again the clinical settings, right? So I would say that bimodal, right? But if you go beyond this, and then others are also relying on them for research and then administration, then we can see multimodal, right? Okay, so one of the primary ways that informatics has changed nursing practice is through documentation. Digital innovations or inventions have lessened the impact of what? The manual, processes of what? Documentation. We can all attest to that. That documentation has really, minimized. Nurses are more likely to input notes into electronic health records and other systems, ensuring their medical records are kept up to date, right? So EHR make all this accessible. So let's look at this one. Provides a work list to remind staff of planned nursing interventions. So we are through, let's say, decision support systems. Nurses can be reminded or prompted to do the needful, right? And then there could also be something that we can monitor in terms of what who is on duty. That one has to do with even administration, right? But we can always ensure that we prompt staff whenever it is what required. Who is on duty, who is not on duty, who is on call. All these are very important. Then electronic medical records and computer-based of patient records. That is what you are witnessing at your various facilities. Then monitoring devices that record vital signs. Vital signs is an integral part of what? Electronic health records. So we can view vital signs as a type of data stored on electronic health records, right? So that you can record all the necessary vitals. Then reminders and prompts that appear during documentation to ensure comprehensive for charting. All these are also very important. And then computer generated or client or documentation, where you can just use the system to generate your own information or information on the system. You can rely on those information to make what decision. So because of our time, I'll just have to pause here. Then next time we will look at what nursing administration among others. But before you go, let me pause and then see whether somebody has what some comment to make. Then we end proceedings. I think the time is 3:15 and not 3:45, right?
Yes, sir.
3:15, right?
Yes, sir. Sir, 3:15.
Okay.
Yes, sir.
Okay, so we need to end our meeting. So I want to see whether maybe you have some last comment to make. Then, okay. So in the absence of maybe further, okay, I've seen one hand. Please let me hear you before. Let me hear you. Oh, just feel free and then ask. Is it Rejoice? Okay, Mary. Mary, go ahead with your question and then let's end. Okay. So I think there are no questions. So I thank you all for making it. This afternoon. But my problem is that we have not gotten up to the number required. It's just 357 out of over 500. So it is still not encouraging. So just encourage them to ensure next week they join. Until then, until we meet again, enjoy the rest of your meetings. Bye-bye.
Bye.
Bye.